Next, from Springfield, we head to the House floor for a quick discussion of a bill aimed at curbing heroin use and preventing heroin overdose deaths. This runs about 7 minutes.
I'm sure most of you know that over a year ago, at my request, the Speaker put a task force together, a bipartisan task force of House members, to study the issue of heroin abuse in our state. Of course, it went on to other drug abuse as well. This task force traveled the state and talked to anyone that wanted to talk to us. Victims, state agencies, doctors, coroners, pharmacists, judges, all kinds of people in the process. And we had a mountain of testimony to go through. Subsequent to that, in January, we introduced House Bill 1, a comprehensive package to deal with drug abuse and heroin addiction in the state of Illinois at a time where we have a huge problem, a problem that's geometrically going out of control faster than in most other states. There were, of course, some opponents to this bill, some people that felt we had gone too far, and so we met with IRMA and the pharmacies and the doctors and the dentists and the hospitals and the insurance companies. And all of those opponents are no longer opponents. This is a well-negotiated, comprehensive piece of legislation that will do much to rid our state of heroin abuse and other drug dependencies. It is a large bill. It's 250 pages long. You all have an analysis. I don't wish to read it to you, but let me try to go at least through some of the general bullet points. First, it goes into the areas of describing and dispensing controlled substances and requires a physician to document in a patient's medical record the medical necessity for the amount and duration of any 3 sequential 30-day prescriptions for Schedule II narcotics. Next, it enhances something called the Prescription Monitoring Program, which is an electronic monitoring that doctors and pharmacies and hospitals and others in the pipeline access to determine if certain patients are doctor shopping, ER shopping, and piling up more and more and more prescriptions. It deals with the issue of disposing of old pharmaceuticals that people aren't using so that they can't get back into them and their families can't reach into their medicine chests and take them. It adds penalties for the deception and fraud of fraudulent prescriptions, talks about overdose sharing information, creates a plan for drug education in our schools, and not simply the old just say no approach, but some real work in the area of education has been done by a few agencies in our state which really know how to educate kids in a way they can understand. It changes rules regarding drug courts so that more people at an appropriate time can have more access to drug courts, so that we can move away from a criminal model toward a rehab model of taking care of people and getting them back to normalcy. There are many changes relative to insurance and doctors, which they no longer object to. In short, this is a bill that will do much in an area where we've done very little in our state. And as I look at the literature around the country, I see that some states are doing a little here and a little there, but this, ladies and gentlemen, is the most comprehensive bill on this subject ever written in this country. And we've been told that even our federal partners are looking at this as a potential national model. So I'm proud of the work we've done. And
Thank you, Mr. Speaker. Will the sponsor yield?
He indicates that he will.
Leader, obviously, I commend you for an extraordinary effort. I'm glad you mentioned former Representative Rebeletti. This was important and still is important to him. And obviously, thank you to everyone involved in this. I just want to ask a couple of questions because this is a big bill. It's an important bill. I think you used the word comprehensive 3, maybe 4 times. So I want to make sure, first, there are no known opponents to the bill as it stands today?
I think it's fair to say that certain state agencies have some concerns. We've tried to alleviate those concerns, but none of the usual people that would be in this building, people representing pharmaceutical companies or doctors or IRMA or pharmacies or doctors, none of those folks are opposed to this bill.
How about the insurance folks?
The insurance companies are either for the bill or neutral. None are opposed.
Perfect. Maybe there is no expense, but I had assumed in a bill of this large S that there would be a component, an expense associated with the programs associated thereunder. Is there an expense for this bill, Leader Lang?
Certainly this bill will cost us some dollars.
Could you be a little more specific?
Yeah, I'm going to try to do that for you without actually giving you numbers, because the problem is that the state agencies really haven't given us any dollars. We've asked for numbers. The first numbers they came up with, admittedly, by their own admission, were made up. They don't know, I don't mean they did it on purpose, they just don't know the real numbers. But I would say this, the agencies that have tried to put together numbers have all made one fatal mistake, and that is to fail to net out the savings. And so if it costs one agency a few dollars more, it's going to save the Department of Corrections a whole lot of money. So no one ever came to us with what we're saving in some agencies as it costs a few dollars in others.
So you've heard gross numbers, not necessarily net numbers.
That's correct, and if I had the gross numbers, I would give them to you. I just don't think anyone knows, and I don't think we know the actual savings on the other end when you net out. I also think, and you would know this as well, we can't possibly measure in dollars the lives that will be saved by this bill. So some would say we can't afford to do this. I would say, considering Illinois' place in this country dealing with drug addiction, which is in a very bad place, we can't afford not to do this.
And I certainly...